All right, good afternoon, everybody. Before you today is the Chairman's Mark for the FY17 Agricultural, Rural Development, Food and Drug Administration Related Agencies Appropriations Bill. The Subcommittee's discretionary allocation is $21.3 billion. The bill meets that allocation. Discretionary spending in this bill is $451 million below FY16 enacted level and $281 million below the President's budget request. When the subcommittee first began meeting for the FY17 appropriations process, as you know, we had four guiding principles that as we move through the process that we discussed. Number one, increasing oversight efficiency and the need for effective outcomes. Second, keeping rural America vibrant. Number three, supporting American farmers, ranchers, and producers. And fourth, protecting the health of plants, people, and animals. And these are the four guided principles that we looked at as we move forward with the President's budget. The basic framework to help us set priorities during the 11 budget and oversight hearings this year, which covered all of USDA's mission area, as well as the Food and Drug Administration and the Commodities Future Trading Commission. They also formed a framework for us to consider the many bills and report requests we received from our colleagues. It is encouraging that the report and this had an interest by a large level of members. We had nearly 4,700 requests from 334 Republican and Democrat members to support, deny, or amend funding levels in the numerous accounts in the bill. We try to address these requests in a bipartisan manner by providing programmatic funding or by including language in the bill or including report language in accordance with the House rules, but of course, by law, no earmarks in the bill. There are a few areas that I want to highlight today. First, the bill includes critical funding for rural development programs, and I, like many of you, come from rural areas, a rural district. Despite repeated proposals by the administration to reduce funding for certain rural development programs, we have ensured funding for such programs like the Mutual and Self-Help Housing Program, the Business and Industry Loan Program, and the Water and Waste Disposal Program. The bill maintains funding levels for the community facility loans and the rural utility service electric loans and safeguards that lending is driven by the needs of the borrower. We also provide the necessary funding for the rental assistance program to serve the very low-income residents. Second, this bill provides targeted increases for animal and plant pest and disease. In particular, we have added funding to help address the devastating effects and the prevention of citrus greening, fruit fly infestations, and the crisis in the poultry industry as the result of the highly pathogenic avian influenza. Most of you are aware that the outbreak of the avian influenza cost the economy well over $1 billion, and there are a number of communities that are still hurting because of it. We have to be ready to address this. The bill also provides for the animal and plant health inspection services with nearly $10 million for on-farm surveillance and data collection to enhance the understanding of on-farm levels of antibiotic use and the impact of the antimicrobial resistance levels. Too often, animal agriculture gets the majority of the blame for contributing to the antimicrobial resistance, but we must remember that human use of these drugs and the consequences that result with antibiotics are overprescribed and not taken according to medical advice. Third, we have provided an increase of more than $33 million for food safety through the FDA to provide for the implementation of the pending regulations associated with the Food Safety Modernization Act. FDA will spend approximately $1.3 billion on food safety this fiscal year. We have added to this total in the bill and have provided approximately $340 million for food safety since 2011. Also, we provided the requested amount of $5 million for USDA's extension service instead of FDA officials to serve as the whole educator on FSMA regulations at the farm level. Lastly, we have provided some key funding increases for those successful programs with bipartisan support. The bill provides a $25 million increase for the Agriculture and Food Research Initiative, which is USDA's premier competitive research program. An additional $19 million is provided for the purchase of commodities for the Emergency Food Assistance Program. This funding will keep this program funding with the funding level of FY16. The bill also continues our commitment to ensuring low-income children receive nutritious meals throughout the summer months by providing more than $628 million for the Summer Food Service Program. In addition, the bill continues funding for the Summer Electronic Benefit Transfer for Children pilot program, or so-called Summer EBT. We've also included an increase of $9.4 million for medical product safety measures in FDA. It is a pleasure to present to you a bill that will impact every American every day of the year. Through this legislation, we support America's farmers and ranchers who are vital to our nation's economy and to our health and well-being. We are blessed by a very diverse and plentiful food supply in this nation that is made partly because of the programs that we have included in this bill, which assist farmers and ranchers across the nation. We help others around the world who face starvation and malnutrition. We support research and development in agriculture to improve productivity and stability. We support the oversight of commodity markets, providing confidence in businesses, traders, investors, and the public. We are fortunate as a nation that we can indeed support these vital programs. So in closing, I would like to ask for your support for this bill as we do this markup this afternoon. Before I recognize the ranking member of the subcommittee, Mr. Farr, for his comments, I want to thank him for his dedicated service to this Congress over the past 23 years. During this last subcommittee markup, we took time to thank him for his work, and certainly he is a close friend and colleague and someone that I've enjoyed and get to know over the past several years, and he has been a real passionate advocate for agriculture over the years. And so, Sam, we appreciate your heartfelt support, and you certainly will be missed. And when I say, I think I speak for all of the other members when I say that we will all have an empty place in our hearts for you around this table, but we wish you the best. And we're, of course, we're not getting rid of you yet. You'll still be here with us for the rest of the year, but Ben, this is the last official subcommittee markup for this subcommittee. I did want to say that, and do thank you for your service.
Thank you very much, Mr. Chairman, for those kind remarks. I think I feel like I'm dead or something. I also think that people are glad to get rid of me, and the sooner the better. But it has been an incredible 22 years, 23 years here, and representing what we call the salad bowl capital of the world, it's obviously very important that I'm on this committee, and I've learned a lot about all of agriculture and all of the world from here, and developed wonderful friendships. So thank you for your leadership. I also want to thank you for putting together such a balanced bill. The total of this bill allows for $147.7 billion in both discretionary and mandatory funding. However, it's $29 billion below what the president requested and $6.9 billion above the fiscal year enacted, mostly because of the mandatory spending in the Farm Bill. Discretionary funding alone provided by this bill is $21.3 billion. However, it's $451 million below the fiscal year 2016. And while I think nobody got everything they wanted, everybody got something. And I appreciate the effort you made for specialty crops, for organic, for pest detection, nutrition, research, and animal welfare. There are several concerns with the bill, though, and they are minor compared to the great things the bill accomplishes when you think about the impact this bill is going to have on all of America. So I thank you and your staff for a job really well done. And I agree with my chairman, Mr. Rogers, when he said our farmers, ranchers, and food and drug producers are the backbone of a healthy nation. It was very interesting when Secretary Vilsack was here. He pointed out to us that we only have about 200,000 farmers in America, and yet they are the backbone that allows the rest of us in the world to go out and pursue our own professions. We don't have to go out and worry about feeding ourselves every day. So it's really important to recognize what a backbone, as the chairman talked about, U.S. agriculture is. I think we also need some very smart reforms in agriculture, and I think this committee is asking the right questions of how we get there. It's also the bill that breathes life into rural America. It's and the majority of poverty in America still is in rural America. So it's very important that we pay attention to this, despite the fact we've had a war on poverty since the 60s. We have not done much to move the needle, and I think we begin to see that the totality of rural America counts, not just sort of categorical programs. And I hope that we'll be able to offer some changes along the way. The CFTC, on the issue of implementing the Dodd-Frank reforms, the CFTC needs adequate funding to implement the regulations we directed them to do. With an appropriation of $250 million, which is $80 million below what the president requested, the CFTC continues to be grossly underfunded, given its congressionally mandated jurisdiction, which is now 7 times bigger than when we started, before we adopted Dodd-Frank. I think we're underfunding this to the detriment of the American economy. Someday we're going to have a crisis, and this is the agency that is the cop on the beat, the referee out there, and if we continually to try to starve it, it's not going to be able to do its job. So I believe the funding level should reflect its role as a crucial financial first responder and regulator of a hugely important derivatives market. Also, in feeding the world, I'm concerned about the lack of flexibility given to USAID in the use of these funds, as well as the lack of funds for local and regional procurement program authorized in the 2014 Farm Bill. As I pointed out in our testimony, is that this has become the most expensive food in the world by the time it gets to foreign markets, and does not allow the host countries to develop any kind of agricultural base, as long as there's always food coming from somewhere else. And the thought here is to use some of that money to help develop these local agricultural bases in countries that we've been dependent on our food aid. But I appreciate the chair's inclusion of $1.4 billion for Food for Peace. This is U.S.'s flagship food security program that literally saves tens of millions of lives every year. I'm concerned, though, with the notwithstanding language in the bill that my notes mixed up here, that would prevent funds from other pots of money, for example, from moving it around, from being used towards a safe box funding requirement. We need smart food aid reform that prioritizes efficiency in feeding as many people as possible. With the FDA, which is under our committee's jurisdiction, it's another agency that Congress has given a huge job to do. Too often the money does not follow the mission. However, I'm glad to see that the bill gives FDA a boost of $33 million over last year's bill, with most of it designated to implementing the Food Safety Modernization Act. The bill also makes modest increases in the Precision Medicine Initiative, maintains funding for the important Medical Countermeasures Program, and provides $10 million to backfill the Zika virus. In the report accompanying the bill, the committee sets strong standards for fighting opioid abuse, addresses the issues of pharmacy compounding, and demands further action on sunscreen development. There will be some dissent on other issues, I'm sure, but such as concerning the cigars and generic labeling. And I look forward to letting the committee work its will on these matters. I want to continue to work together so as we move through the process to get this bill done, we can accomplish and address some of those issues. In 1999, when I started this subcommittee, we did it under regular order, and then we seemed to hit a dry spell for several years. I look forward to finishing this bill under regular order, and as I end my congressional career, getting us back into the groove. Also, I've been stated publicly that I think it's very important that we bring back earmarks. As controversial as they are, I think we do a poor job in explaining that rural America probably can't survive without earmarks, because money is distributed on a formula basis, and there's just not enough people in rural America to get the sums of money that are necessary to do infrastructure development. And I hope that we will work to bring those back so that we can really address those crucial issues. So I look forward to becoming a full-time babysitter for my granddaughter Ella and my grandson Zach. I want to see this bill through, because even in hard time that we need to think about investments, that we make today and how it will impact their future. And I really appreciate all the support I've had on this committee and the colleagues I've worked with, some of the finest people in the world. So thank you for giving me the opportunity to be your ranking member.
Thank you, Mr. Farr. And this time, I'd like to recognize the chairman of the full committee, Mr. Rogers.
Well, thank you, Mr. Chairman, for yielding, and more importantly, congratulations on a good bill that you and Mr. Farr and your subcommittee has worked out. You've worked tirelessly along with staff to make this bill a good bill. This is the third bill that's in play now. We, of course, marked up in full committee earlier today, one bill, and then Energy and Water in subcommittee a few minutes ago, and now this one. And I think this probably is the earliest that we've done this bill, to my recollection. Sam, you might know better than me. But the war on poverty in rural areas is still alive and well, unfortunately. A lot of our rural areas are steeped in poverty. In fact, when LBJ went to Kentucky in my district in 1965 to kick off the war on poverty, a bystander was heard to comment, if we didn't have this poverty thing, we wouldn't have anything. Which is true. Sam Farr, what a record you've achieved here in the 23 years that you've served in the House. Is it 17 of that on this subcommittee? Well, you've done a marvelous job, and we appreciate your service to us and to Congress and to the country. We will miss you. But boy, I tell you what, staying away from Monterey Peninsula for 23 years doesn't speak well of your intelligence.
I think we need a Codell to show us our agriculture out there.
Anyway, thank you for your service.
Thank you very much.
This is a good bill. Appropriates $21.3 billion. I think you've struck a delicate balance, thoughtful savings, and then retaining necessary funding for important ag and food programs. You address the current and future challenges of ag research. You increase support for programs that combat animal and plant disease. And you increase support for food safety and medical product safety. Also including legislative provisions to help weed out waste, fraud, abuse in nutrition programs to help make sure every taxpayer dollar is spent efficiently. Rural communities are vital to the U.S. economy, as you said, because this subcommittee understands the essential role that USDA plays in improving rural economies. You fund initiatives within rural development at $2.8 billion. That's a 30% increase, by the way, over 2013. That funding level allows USDA to continue programs vital to the preservation of and empowerment of rural America, like the 502 Direct Loan Program that supports low-income families in achieving their dream of safe, affordable home ownership. Continued support for the Water and Waste Program that will allow rural communities to properly treat wastewater, will allow rural communities to provide safe, clean drinking water. Furthermore, the Electric and Telecommunications Program makes sure that loans are available to help build and maintain infrastructure that's critical for economic development in these rural areas. With strong programs like these, as well as the business and industry loan program, rural communities can continue to work with USDA to build stronger regional economies. In addition, on the heels of the 5th annual National Prescription Drug Abuse and Heroin Summit earlier this month in Atlanta, this bill continues to prioritize efforts at the FDA to combat the scourge of prescription drug abuse, which kills more people now than car wrecks. For years, the committee has encouraged the FDA to utilize the full breadth of its regulatory authority to address this challenge, and this bill is no exception. FDA's recent regulatory changes related to scheduling and labeling of opioids are positive developments, as are efforts to encourage the development of abuse-deterrent formulations of these pills and new evidence-based medication-assisted therapies. However, the legislation cautions FDA that treatment is not a one-size-fits-all enterprise, and that every patient's treatment regimen should be tailored by his or her doctor to his or her unique needs. I know we all look forward to working with the new commissioner of FDA to build on these recent developments in order to save lives. So I want to commend the chairman and ranking member for putting together a good bill. I urge the subcommittee to report the bill to the full committee, where we hope to pass it intact. I yield back.
Thank you, Chairman Rogers. Ranking Member Louie.
Well, I thank Chairman Adable and Chairman Rogers for the work on this bill, and a special thank you to our good friend, Ranking Member Sam Farr. You've been so committed to these issues for a very, very long time, and we will really miss you, but I know you will keep in touch in the midst of your all-important babysitting duties, and nothing's more important than that, and we can celebrate our birthdays together. So I thank you for years of commitment and hard work. It's really been a pleasure. Let me just say to my colleagues, you've heard me say this a few times this morning, but I think I'll reiterate. We've heard from the Republican leadership that the budget and appropriations process will return to regular order and adhere to the bipartisan agreement enacted in 2015. But here we are, the third subcommittee markup, and we haven't passed a budget, and it's doubtful we will. And we know why. There are those advocates that are reneging on last year's bipartisan budget agreement and rejecting as insufficiently radical a Republican budget resolution that would devastate good-paying jobs and the Medicare guarantee and increase poverty. Now, Speaker Ryan says appropriation bills will not be considered on the floor unless a budget is passed. But tomorrow, House leadership will consider proposals to change House rules that would cut lifelines for seniors and families, which would blow up the appropriations process. So many of us are concerned. I know our chairman is, because we've had a whole series of important hearings, and now we're beginning to mark up. And I know my friend, Mr. Rogers, would like to see regular order. However, we are facing this challenge. The agricultural bill contains a number of national priorities, including the safety and quality of our food supply, rural development, healthy meals for children, commodities regulation, approval of new potentially life-saving medicines. Unfortunately, however, at $451 million below current levels, this bill does undercut many of these important priorities. Increases for the FDA and stable funding for Food for Peace are positive. However, this bill would reduce school kitchen equipment grants, the summer EBT program, which in effect takes healthy foods out of the mouths of hungry kids. You know, that one I don't understand, because it seems to me we should be able to figure out a way to feed these kids in the summer who are on school lunch programs, and I do hope we can address that before the process is over. And in addition, this subcommittee's lack of focus on the needs of the CFTC, which protects small businesses, family farms, ordinary investors from improper business dealings, is of great concern. Finally, contentious policy provisions have no place in an appropriations bill, delay our ability to address national priorities that improve the health and safety of Americans, and jeopardize our ability to move all 12 bills through regular order. Riders on tobacco, genetically modified organisms just should not be in this bill, especially when the science is clear that cigars are bad for public health. I don't know why I'm just smiling, Mr. Chairman, when I mention cigars. And the verdict is,
They have wrappers.
some of my best friends may disagree with me on that issue. But let's say the verdict is still out on GMOs. We have serious issues to address, cannot afford these needless delays. The administration should never have been forced by the majorities in action to redirect funding that is still needed to combat Ebola in order to mount a robust response to Zika, which just yesterday the CDC described as, quote, scarier than we initially thought. Experts believe that Zika leads to not only deadly birth defects in infants, it can lead to paralysis, swelling of the brain, spinal cord in adults, among other serious health conditions. Frankly, we don't have the luxury of fighting one public health crisis or another. We must do both. And resources are urgently needed to help Flint and fight the epidemic of opioid abuse. Certainly our chairman has been eloquent on this issue and very forceful on this issue, and I look forward to continuing to work with the chairman on the issue of opiate abuse. Meeting these responsibilities will require emergency spending, flexibility, and wisdom in allocating our scarce resources. I look forward to working with you, Mr. Chairman, and all of my colleagues to meet these needs. And I thank you.
Okay, thank you, Ms. Lowy. Is there any further discussion from members? Yes, Mr. Oro. Mr. Oro.
For statements or?
Yes,
Yes,
yes.
Yes, thank you. Thank you, Mr.
Yeah, go ahead.
Thank you very much, Mr. Chairman. First, I would like to acknowledge Chairman Adderholt, Ranking Member Farr, the hard work on the subcommittee bill. Having chaired this subcommittee in the past, I know firsthand the amount of work that it takes, so I thank both of you. I'll also just make an aside comment here that I'm curious about the process of getting to various allocations and how that process is going for the bill we took up this morning, this afternoon, and apparently energy and water. What is it they said about Russia? It's an enigma wrapped in a mystery. In this bill, I am pleased to see sufficient funding levels for hunger programs and for international food aid. I'm also glad to see the inclusion of language that restricts the ability of Chinese chicken to end up on the plates of our school children. Very concerned about Americans consuming Chinese chicken given China's torrid history with food safety. And now that we have the repeal of country of origin labeling, we would have no idea of where our food is coming from. That being said, I think you can surmise that I sadly cannot support the bill as it stands. Once again, the House majority has put forward a proposal that, in my view, fails to meet many important responsibilities under the subcommittee's purview, and that threaten both the health and the well-being of American families. I'm deeply troubled by some of the bill and report language that has been included, which could completely undermine our regulatory agencies' ability to do their jobs. First off, it really is appalling to see certain provisions of the 21st Century Cures Act included in this bill. We should not enact new legislation on appropriations bills. Furthermore, really concerned to see the inclusion of language that tries to delay FDA's ability to finalize guidance on laboratory-developed tests, which are Wild West, currently unregulated. To further delay FDA's guidance could be a matter of life or death. We're not talking roads, bridges here. I have heard, and maybe others have heard, of the horror stories of these tests giving false positives, resulting in patients receiving unnecessary treatment and surgeries. Given the movement that we have today on precision medicine, it is now even more important to finalize this guidance. Laboratory-developed tests are the precipice for people receiving treatment from life-threatening diseases, and having the FDA regulate them will help to ensure that they are more accurate and they are timely. Also concerned to see the lack of adequate resources for the FDA to properly keep our food supply safe. The Food Safety Modernization Act is in desperate need of robust funding, given that this body has provided less than half of the funding that is needed. And yet again, the Appropriations Bill provides a modest increase for FSMA at best. Under the President's proposed trade deals, more unregulated food will be crossing our borders with insufficient inspectors, and we will be putting our population at risk of all manner of foodborne illnesses. I was disappointed to see language aimed at rooting out fraud, waste, and abuse in the SNAP program, yet no language for other subsidy programs such as crop insurance, which has a high error rate and is in dire need of reform. Along those same lines, I take issue with the new language in this bill that would require SNAP recipients moving out of state to notify their state board. I don't know if others are frustrated by report language on tanning beds that encourages the FDA to meet with industry before moving forward with regulations when we know what's happening, particularly to young girls, and the cancer rate from these tanning beds. I worked closely with the administration to make sure that they could restrict the use of tanning beds for people under the age of 18. Melanoma rates for young women ages 15 to 30 have tripled over the past 35 years and are now the second most common cancer in U.S. women ages 20 to 29. The time to act on this is now, not after meetings with industry. I'm also concerned to see that this bill would exempt premium and large cigars from FDA deeming regulations. I suppose I have to smile the way my colleague Mrs. Lowy does as well. Also, the bill continues to deeply underfund Commodity Futures Trading Commission. While the President proposed an $80 million increase, we should not undermine CFTC's ability to oversee risky market behaviors, protect consumers, and enforce the law by providing insufficient funding. This will cripple the agency, leave it without the tools that it needs to properly oversee massive commodities markets. I'm disappointed that this bill further delays the FDA from finalizing menu labeling. Consumers have a right to know the nutritional content of their food. We should not continue to kick the can down the road when it comes to menu labeling. And finally, it is a shame that there is both bill and report language to prevent the FDA from finalizing their rule on generic drug labeling. This rule would allow more affordable generic drugs to update their labels with new safety information, just like name brand drugs have done for almost 30 years. Overall, despite some modest increases, this bill leaves large swaths of the general public at risk and vulnerable to food and drug safety threats. And as I said, as such, I cannot support the bill. I was just had the opportunity to read a document that was produced, new estimates of historical trends using poverty measures. It's an academic paper done by folks at Columbia University. It's called Progress on Poverty because so many, the chairman referred to rural poverty. There's so many programs that talk about poverty. We're interested in this year. And their conclusion, and read it, they're academics. They don't have political philosophies that are throughout their document. It is pure science and research about child poverty and deep child poverty. In 2012, government programs reduced both child poverty and deep poverty by 11 percentage points. Those are the government programs, many of which are in this bill, and we ought to increase the opportunity for resources so that we can, in fact, decrease poverty, particularly amongst children in the United States. Thank you, and thank you, Mr. Chairman, for allowing me so much time. I appreciate it.
Okay, thank you. Any further discussion or amendments that maybe anyone wish to offer to measure before us?
Mr. Chairman,
Yes, sir.
you know, we, on our committee especially, have been talking so much about the dramatic increase in mandatory spending, crowding out discretionary spending, which we do. And it grows every day, every minute. Your bill is probably one of the best examples of that problem. There's about a $500 million drop in discretionary spending, and there's a $7.5 billion increase in mandatory. Dramatic difference. But that typifies what we're dealing with. You know, now, when I came to Congress, we appropriated 2/3 of all federal spending. Now it's less than 1/3. It's about a fourth. And in the meantime, mandatory has just grown out of sorts. And it's something we're going to have to address. It's tough, because a lot of the mandatory spending in this bill, of course, is SNAP, which all of us recognize a need for. But nevertheless, we've got to find a way to put some sort of lid, controls, on mandatory spending, lest everything we have goes into mandatory and none for discretionary, including the military. Nevertheless, I wanted to make that point.
Yeah, thank you for that observation. And as you say, when you first came to Congress, it was 2/3 was appropriated, and based on where we're going in 20 years, it's going to be really challenging for what we have to do. If there's no further amendments, I would recognize a distinguished member from California, Mr. Valadeo, for a motion.
Mr. Chairman, I move the bill be favorably reported to the full committee.
All those in favor say aye.
Aye.
Those opposed, nay.
No?
The ayes have it. The motion is approved. And I would ask unanimous consent that staff be permitted to make technical and conforming changes to the measure just approved. And if you would please make sure that the materials before you return to the subcommittee staff before we leave for the room. And with that, the subcommittee is adjourned.
Mr. Shan. This is a sham.
It really
This
is.
is a sham. This is ephemeral. It's a sham, is what it is here. We're just going down a road to nowhere in this committee.
We can show you more diverse agriculture out there, modern technology.
Yeah, well, yeah, but you know what? That all